Hi, my name is Marsha Vigo, and this is my informative speech on marijuana. Many would argue that medical marijuana is just a front for recreational use, and some would argue that it's too dangerous to use, while others believe that it helps with certain diseases, leading some to wonder if medical marijuana should even be considered as an option. Medical marijuana shows considerable promise in reducing chronic pain from a wide variety of causes such as cancer, spinal cord injury, spasm, and post-traumatic stress disorder, as well as many others. The drug is proved to be useful in applicants who used it. Marijuana also provides relief to common conditions associated with chronic pain, as well as anxiety, depression, and insomnia. The addictive effect of marijuana is considerably slight, and there's no risk of death. With marijuana withdrawal, Jocelyn Elders, MD, former U.S. Surgeon General, wrote the following in an article titled Myths About Medical Marijuana, published in the Providence Journal. She stated the evidence is overwhelming that marijuana can relieve certain types of pain, nausea, vomiting, and other symptoms caused by such illnesses, and it can do so with remarkable safety. Indeed, marijuana is less toxic than many other drugs that physicians prescribe every day. The National Organization for the Reform of Marijuana Laws stated the following: marijuana, or cannabis, as it is most appropriately called, has been part of humanity's medicine chest for almost as long as history has been recorded. However, according to Scott Buvera, a registered pharmacist, the use of psychoactive drugs like marijuana is a health issue, partly when used for medical purposes. There is a lack of high-quality data that shows marijuana for most medical purposes as both safe and effective. There are significant gaps in information necessary to treat marijuana, like other forms of medicine. The U.S. Food and Drug Administration has not recognized the use of marijuana as a safe and effective drug for any indication. According to the website www.fda.gov has confirmed, and as current in the position, marijuana is listed in Schedule 1 of the Controlled Substance Act. Continues to support that placement, and FDA concurred because marijuana has a high potential for abuse and has the lack of accepted safety for use under medical supervision. Marijuana has no credibility. It has not passed the rigors of scientific investigation. It has not demonstrated significant efficiency in symptom relief, and it causes harm. Frequent marijuana use can seriously affect your short-term memory, and it can impair your cognitive ability and lead to long-lasting depression or anxiety. While many smoke it to relax, which could have the opposite effect on frequent users, and smoking anything, whether it is tobacco or marijuana, can seriously damage your lung tissue. Marijuana is not a safe drug as it is portrayed by the public. It is addictive, and it affects your immune system, and it opens a gateway to other drugs like cocaine. And it is linked to cases of cancer, causing respiratory diseases, mental disorder, including psychosis, panic attacks, hallucination, and much more. Medicalizing marijuana can cause people who are truly ill to refuse proper medical care, thinking that marijuana is helping them to get better because it makes them feel good. In conclusion, there is currently sound evidence that smoking marijuana is harmful, and there is no sound scientific study supported that the medical use of marijuana for treatment in the U.S., and no animal or human data supported the safety of marijuana for general use, even though some applicants that have reported it to be helpful for some injuries or diseases. But the question still remains if marijuana should be considered as an option, even though it has been legalized for medical use.